Today we will do the liver. So liver is the largest gland of the human body and it lies in the right hypochondrium and it is the seat of the metabolism. So the hepatocytes, they have got the high metabolic activity. The average weight of the liver is about 1.5 kg and it lies in the right hypochondrium. Along with the gallbladder below it. We cannot touch a normal liver because it lies below the subcostal margin. That is the fused 7th, 8th, 9th and the 10th costal cartilages. Protects its anterior or the inferior border. And liver is convex superiorly and it occupies the anterior the inferior border parallel to the fused 7th, 8th, 9th and 11th costal cartilage. The maximum convexity of the liver goes up to the level of the right nipple and it is very soft in texture. The liver is full of blood and it is soft like the jelly we eat. So whenever there is a traumatic or accidental injury or a tear in the liver, so the bleeding is unstoppable and we cannot stitch the liver to stop the bleeding because it is a jelly-like and a very soft organ. So fused 7th, 8th and 9th and 10th costal cartilages, they protect the liver and liver lies above this subcostal margin. And when we separate the liver, when we want to do the morphology of the liver. So liver has got the anatomically two lobes are present. A right large lobe and the small left lobe. And both are separated by the falciform ligament. So the falciform ligament, it divides the two unequal halves of the liver, that is the small left liver and the large right liver. And this double fold of the peritoneum is called the falciform ligament, which is sickle shaped and it attaches the liver with the umbilicus. And the lower free border of this sickle shaped falciform ligament contains the obliterated umbilical vein, left umbilical vein. Left is left. So this is the lower free border of falciform ligament is called ligamentum teres. So two folds of the peritoneum with obliterated umbilical, left obliterated umbilical vein from the ligamentum teres. And this ligamentum teres connect to the umbilicus. So that is how the two right and left lobes of the liver is divided. This is the anterior surface of the liver, which is covered by the costal cartilages and protected by the ribs. The 5th, 6th, 7th, 8th, 9th and 10th ribs, they protect the anterior and the lateral surface of the liver. And it has got this anterior sharp border It is also called inferior border because it is facing the whole of the abdomen. So it is called the anterior or the inferior border. There lies the umbilicus in the midline. And we cannot touch the normal liver because it lies inside the costal cartilage. So whenever the liver enlarges, it comes below and parallel to this subcostal margin. Then we say whether the liver is one finger enlargement depending upon, or it is two finger depending upon how much it has come below the subcostal margin. We measure the enlargement or the hepatomegaly with the one finger breath or two finger breath. So that is the mode of the measurement. Now when we separate the liver, remove the liver from the body, what is the structure we see here? So this is the falciform ligament dividing the small left and the large liver, and this is the ligamentum teres containing obliterated umbilical vein. So this is the anterior or the inferior sharp border from left to right. And on this border we have got the ligamentum teres which is hanging. Then just lateral here, liver has got a notch. This notch is called the cystic notch. Because it lodges the fundus of the gallbladder here. And this fundus of the gallbladder is lying just here, lateral to the ligamentum teres, touching the tip of the ninth costal cartilage. So at the level of the ninth costal cartilage, the fundus of the liver comes out of the anterior or the inferior border. So this ninth costal cartilage tip is called the Murphy's point. This is Murphy's point. So whenever we are suspicious of the gallstones, so we press the right hypochondrial region on right side, we press the ninth costal cartilage tip. Then we press at the Murphy's point and we see the face of the patient. If the patient feels tenderness, this is the diagnostic of the cholecystitis or the gallstone. So touching the tip of the ninth costal cartilage or the Murphy's point means we are indirectly touching the fundus of the gallbladder. If there is a stone or pus inside the gallbladder, we are pressing it and it gives the pain to the patient. So that is the positivity of this. Then between the ligamentum teres and the cystic notch of the gallbladder, so this part of the liver, this is a lobe of the liver, and this is called the quadrate lobe. So they are the features of the anterior or the inferior sharp border. We see here ligamentum teres, we see here the quadrate lobe, and we see here the gallbladder lying in the groove for the gallbladder and the cystic notch. Rest of this is the anterior surface, and rest of the anterior surface is covered by peritoneum. And this is the visceral peritoneum of the liver. This is the visceral peritoneum of the liver, which form the double fold of the falciform ligament. And this capsule of this visceral peritoneum covering the whole of the liver is called the Glison's capsule. This is the Glison's capsule. This is the Glison's capsule. So it is covered here. But the gallbladder, the fundus of the gallbladder is extra peritoneum in position. So it is also at the peritoneum, extra peritoneum. It is not covered by the Glison's capsule. because it has emerged out of the anterior or the inferior sharp border. This is the right surface of the liver formed by mainly the right lobe, and it lies in the mid-axillary line, so laterally it is here. Then the upper one, this is the superior surface of the liver. This is the superior surface of the liver. So we take the liver in the diagrammatic view, the right lobe, anterior inferior sharp border, this is the superior surface, anterior surface, this is the right surface. So actually liver is exactly like our hand. If you make like our hand like this, now this is the liver. This is the anterior surface of the liver, this is the anterior or the inferior sharp border. This large is the right lobe of the liver, this is small pointed is the left lobe of the liver, and this is the superior surface. As superior surface is continuous with the anterior, so it is convex here. And if you see on the back side, this is the posterior surface facing the posterior abdominal wall. And this is the inferior surface facing the whole of the general abdominal cavity. So this is the inferior surface, anterior surface, superior surface, posterior surface, and right surface. So these are the surfaces of the. So exactly, if you put our hand like this, it explains all the borders and the surface. So this anterior border is inferior, and this is convex. So superior surface is continuous with the anterior surface. So there is no superior border. Similarly, posteriorly, this is the posterior border, and posterior border is continuous with the posterior surface. So this is also convex. So posterior border is not well defined because like anterior, it is also convex posterior. And the lower facing surface of the liver is the inferior surface. Now, if we want to see the back side of the posterior surface of the liver, so we just reverse it. So now we are on the back side of the liver and we are seeing the back of the liver. So this is the left surface, so this is the left somewhere here, and this is the right surface. So we have seen that from here the falciform ligament comes, and on the left side the same fold of the peritoneum is run towards the left lobe and then again revert back. Similarly from the anterior surface, so this right flap of the peritoneum comes on the right. So this is the left triangular ligament. It is small and linear, as it has to support only the small left lobe, which is thin also. The same right fold of the peritoneum, it goes to the right lobe of the liver and it expands quite large on the posterior surface, and it is convex superiorly and inferiorly like the crown. That's why it is called the right triangular ligament. And right triangular ligament is wide and well defined. It has got the this line is called the superior coronary ligament, and this line is called the inferior coronary ligament. They are called the coronary because they look like the crown on the head. So the same word we are using for the coronary artery. So it is crown-like, so it is called the superior and the inferior coronary ligament. In between this is the hole in the base area of the liver. And we know this base area of the liver is responsible for the in the portal hypertension. The veins of the liver, they communicate directly with the veins of the diaphragm through this base area, and this is one of the portocaval anastomosis side. That is the base area of the liver between the superior and the inferior coronary ligament. The same two folds of the peritoneum, they form the ligamentum venosum on the posterior surface, and then the same fold will go as the ligamentum teres, and and on the posterior inferior surface it also bears the porta hepatis. So this is the ligamentum teres, same way as we have done. So this is the posterior surface and this is very faint. Line is there which separates the posterior surface from the inferior surface. It is very ill-defined. So it is negligible. So superior posterior surface is merged with the inferior surface of the liver. And so this is the ligamentum venosum. And between the ligamentum venosum and the left inferior coronary ligament, a hepatic lobe is created. This is called the C for caudate lobe. This is caudate lobe. And on the inferior surface, what else we see is the groove for the gallbladder, which goes toward the porta hepatis. This groove is below the surface of the liver and it lodges the all parts of the gallbladder, that is the fundus, which comes out of the anterior inferior border. Then this fundus of the gallbladder lead to the large sac like the body of the gallbladder, and then this body of the gallbladder posteriorly becomes narrow, is called the neck of the gallbladder, and this neck then turns, then it forms a pouch that is called the Hartmann's pouch, and then it forms the cystic duct, which is meeting with the common hepatic duct to form the common bile duct. As this is the porta hepatis, so porta hepatis means it's like an airport where flights are boarding and leaving. So same in the porta hepatis we use the word the airport of the liver, where the structures are going in and out of the liver. So portal vein is going inside while the hepatic right and left hepatic ducts are coming out of it, and the hepatic artery proper is going inside. So that is the content of the porta hepatis. That the portal vein lies posteriorly, and on the right side lies the common bile duct, while on the left side lies the hepatic artery proper in front. So these are the portal triad relations in the portal triad in the porta hepatis, that artery is on the left side while the common bile duct is on the right side in the porta hepatis. Then because of the gallbladder, a quadrangular lobe is created here. This is called the Q for the quadrate lobe. So Q and quadrate lobe, and posteriorly there is a quadrate lobe. So quadrate is quadrangular and quadrate lobe is posterior. So both are opposite to each other. Similarly, opposite to the groove for the gallbladder, on the posterior surface of the liver, here lies the groove for the inferior vena cava. And inferior vena cava groove is there. So inferior vena cava lies inside the groove and it is incarcerated in the substance of the liver, and liver is flushed with the inferior vena cava. So 1.5 kg of the weight of the liver cannot press the inferior vena cava because it lies in a groove. Then two veins from the right lobe of the liver, that is the right hepatic veins, two right hepatic veins, they open and pour their impure blood into the inferior vena cava. Similarly, a vein from the left side, a small lobe is the left lobe of the liver, so a vein also opens into the inferior vena cava, so it is the left hepatic veins. So this is how the inferior vena cava, while it is passing behind the liver, embedded in the substance of the liver, receives the venous drainage of the liver via two right hepatic veins and one single from the left lobe is the left hepatic veins. So this is the posterior view and the inferior view together of the liver. Just we have reverted the liver like this. So this is the front of the liver, this is the back side of the liver. So as we have seen from the front here, and then what we are seeing from the behind is this view of the revert of the liver. Now the inferior surface is facing the greater sac or the general abdominal cavity, and various organs, they have got the impressions on the soft jelly-like liver. As we know, on the right side here, like the right kidney has the impressions on the liver, and above is the right suprarenal gland, and medial to this, here lies the duodenum, and the pylorus also touches the inferior surface of the liver, a little bit to the pylorus, the duodenum, suprarenal, and the right kidney. So they are the impressions on the soft liver, because these organs, they are lying very, very close to them. And this porta hepatis has got the hepatic artery proper. As we know, hepatic artery is the branch of the celiac trunk. Has got the left gastric artery, torsio-splenic artery lying retroperitoneally, reaching the lienorenal ligament to reach the spleen. So from the same celiac trunk, a horizontal artery goes towards the right side, called the right hepatic artery. Right common hepatic is called the common hepatic artery, and this common hepatic artery then runs a vertical artery, gives the vertical artery only made for the liver, is called the hepatic artery proper. This hepatic artery proper will go into the porta hepatis and divide into the right and the left hepatic artery. The right hepatic artery will give a branch that is called the cystic artery, and this cystic artery will run in the cystic groove and will supply the gallbladder. So a triangle is created here. It's called the Callot's triangle. This Callot's triangle is very important for the ligation of the right cystic artery in the laparoscopic removal of the gallbladder. So this Callot's triangle is made by the inferior surface of the liver on one side, and here like the right hepatic artery and hepatic artery proper, and in this lies the cystic artery. So this cystic artery is for the ligation of the cholecystectomy, is a very important point that is called the Callot's triangle. That's all about the liver morphology.